So 78% of all the notified cases are found between West Coast 1 and West Coast 2 regions. West Coast 1 has about 53% of the TB cases that are notified. So that's the distribution of the quarters. In every quarter, what happened? Second quarter of 2025 seems to have had more cases notified. TB continues to affect mostly men. And if you look at the highlight in the middle, it's a showcase of the cases notified in LRR. It's one of the regions where zero childhood TB is notified. This is one major gap we think research should focus on and give us answers, because our children seem to be left out.
New data unveiled at the Sadauda Karaba Jawara International Conference Center in Bijilo showcased tuberculosis notifications in the Gambia fell from over 2,800 in 2024 to just under 2,600 in 2025. That is the 233 fewer cases. But health leaders say it is not enough. The Global End TB strategy aimed for a 50% reduction in incidence by 2050. The Gambia has only managed 20%. Welcoming delegates from across the region, including Senegal, Nigeria, Guinea-Bissau, and the Netherlands, the Director of Health Services at the Ministry of Health, Mamadou T. Nyasi, called the Median Forum a critical milestone. He stressed that policies must be driven by data.
Breakthroughs in prevention, diagnosis, treatment, and care, TB continues to affect individuals, families, communities across the globe, including here in the Gambia. As we strive to achieve the targets of the End TB strategy, our policy and programs must be informed by the best available evidence. Research has the power to identify gaps, uncover innovative solutions, and improve the quality of effectiveness of our interventions.
This year's theme, Advancing Evidence to End TB in the Gambia, from research to impact, underlines that exact mission. Organizers say the goal is to ensure that knowledge generated from studies leads to tangible improvements in everyday patient care. The WHO representative to the Gambia, Dr. Nathan Bakiaita, reiterated that tuberculosis remains one of the world's deadliest infectious killers. He warned that valuable medical research is sitting on shelves instead of saving lives on the ground.
Comes at a critical moment. The WHO End TB strategy sets ambitious targets to reduce TB incidence by 90% and TB deaths by 95% by 2035. Achieving these goals will require accelerated action, deeper collaboration, and most importantly, the systematic use of high-quality evidence to drive decisions and results. I commend the Gambia for the significant progress made in TB control. Strengthened case detection, expanded access to rapid diagnostic technologies, and increased community engagement demonstrate strong national commitment and leadership. At the global level, innovations such as rapid molecular diagnostics and shorter, more effective treatment regimens are transforming the TB response and saving lives.
Despite being both preventable and curable, tuberculosis remains the world's leading cause of death from a single infectious agent. The infection affects approximately 10.7 million people annually and claims over 1.2 million lives globally. Currently, about 1/4 of the global population carries a latent TB infection, with over 80% of active cases concentrated in low and middle income countries. Meanwhile, researchers are calling for a shift in approach. Dr. Muyiwa Awolade from the Medical Research Council Unit of the Gambia says the only way to accelerate progress and fight stigma is by giving affected communities a seat at the table.
Of intersectoral services, involvement of non-governmental organizations, and active community participation are essential for effective TB control. TB is closely intertwined with stigma, discrimination, and social determinant of health. Communities of people affected by TB are experts in their care pathways, but the TB field continues to fall short of meaningful, engaging communities in TB research. This is a missed opportunity to improve quality, relevance, person-centeredness, positive impact, and sustainability of TB research outputs.
Lamin Damfa, the Permanent Secretary too at the Ministry of Health, spoke on behalf of the Minister. He says surveillance has improved, but radical rollbacks remain.
Here we have made notable progress over the years through the strengthening surveillance system, improved diagnostic capacity, enhanced treatment services, and expanded community engagement. However, TB continues to pose a significant public health challenge. The emergence of drug-resistant TB, the burden of TB, HIV, co-infections, and other comorbidities, gaps in case detections, and challenges in reaching vulnerable population reminded us that much work remains to be done.
The two-day forum brought together clinicians and policymakers from across the sub-region. The goal now is to forge stronger collaborations that can accelerate interventions and finally eliminate tuberculosis as a public health threat in the Gambia.